Good afternoon, everybody. And before we start, any apologies, Sharon?
Yep, Vera, there's an apology. Yep, there's an apology from Councillor Jackson, and Councillor Murphy is substituting for him today. I noticed Councillor Brooks has a declaration of interest in relation to item 2, which is put in the chat. Are there any other declarations of interest?
Yes, Sharon. I'm a non-executive director of Pertwee Branching Out.
Thank you. I think that's Councillor Quinn now in the meeting.
Okay, good afternoon, Lynn. As this is the first meeting of the operational log type of meetings, I'm proposing to use the following procedure. The report will be presented by Louise, but from sections 4.1, Louise will present that report. 4.2, the COVID evacuation. 4.3, 4.4, and 4.5, Alan will deliver this. 4.6 and 4.7 will be Anne. 4.8 will be Sharon. 4.9 and 4.10. 4.11 will be delivered by Angela, and 4.13 by Louise, and 4.14 by Leslie. Now, if you've got any questions, would you please use the chat function? So Louise will introduce the first couple of pages, and then we go into 4.1. Louise will be addressing that particular item. So if that's quite clear to everyone, I should say after every officer presents their part of their part, I'll stop there and I'll ask for questions before we move on to the next officer. So after every officer presents their item, we can stop, ask questions of them before we move on to the next. As it's a new log, the operational log meeting. So if you're quite happy with that.
For yourself, Councillor Moran, and thank you to elected members for taking the time today. This is a new format as agreed by Council of a one report, and I'm just going to talk a little bit about the recovery. So COVID has had a significant impact on the health and social care. We started planning in March, in February last year. I remember all of the senior management team in February coming together before the pandemic had actually been announced. Since then, we've used business continuity. We've had local resilience management teams, which began in March, originally daily, and then they moved to 3 times a week, and then they moved to twice a week. Eventually moving to once a week, and then because of the second wave, we stepped them back up in January time. They're currently once a week, and in January time we moved back to using the emergency powers and keeping a log, and you'll see in Appendix A there is a log of the decisions that we made in the January time. Most of these decisions are reflective in relation to getting additional staff in order to try and support the Health and Social Care Partnership. There is a decision in relation to home care and moving to essential visits only, which is reviewed on a weekly basis and is particularly important as we've introduced lateral flow testing for our home care staff. And we continue to review it on a weekly basis, but we are still on essential visits. We have also created a recovery plan, and we paused that recovery plan in the winter as we moved into the second wave. And we have been developing a wellbeing plan, and we co-produced that with staff side, the unions, our staff groups, doing a whole load of focus groups, and you'll see that that wellbeing plan is attached to Appendix B. What I would say in relation to the wellbeing plan is that Sharon was given money from the Scottish Government through the Chief Social Work Officer role, and we put the 25,000 to give support to the Health and Social Care Partnership. We have extended the wellbeing plan so that it doesn't just support the staff in the Health and Social Care Partnership, but it supports the independent third sector and those working in health and social care across Inverclyde. I would say that the impact of COVID on the staff group is currently unknown, but we do know from some of the research that we are expecting it will be quite traumatic, and we have had a couple of deaths in Inverclyde of our staff. And so we are very invested in making sure that we get that wellbeing plan right, and that we've been doing a lot of activities across health and social care to promote that. I'm happy to stop and take any questions at this stage, and then I will hand over to Alan.
I'm having a bit of problem operating the chat, but there's any maybe a question for Louise? I see Chana.
Thanks, convener. It's actually in 4.6 and 3.1. It's regarding mental health, and it says a new unit has been built where to get this, and also about during the week, Monday to Friday, it'll be, looks as if it's local, Friday and Saturday. Where's that going? What's happening? Because
I wonder if you could, Councillor Beckett, we're going to be discussing that on 4.6 of a mental health update beyond.
All right, sorry.
Go back to that,
Okay.
and then we can ask that question at that juncture, if that's all right.
That's lovely. That's lovely, convener. Okay.
Has anyone got any Louise on the recovery?
Right, well, the health and social care, where it begin at 3.1, mental health update includes introduction of a new mental health assessment unit. That's the one. Where's that going to be? Where's it going to be issued, or how do people go to it, or what happens? Nobody seems to know what it, at this stage. We don't know what it is, and if people go to it, or have to be through a doctor or through something, you know. So
I don't want to go over the same item twice, so we could leave it, or I'll ask Louise if she want to make a comment now. Louise?
If you want, you can leave it to after.
Yeah, thank you very much, Councillor Becky. It's helpful for you to give Anne forewarning of the question you're going to ask her. So maybe when we get to the mental health update, Anne can maybe cover that.
Okay, thanks.
Right, thank you for that. Has anyone else got any questions on the recovery?
Yes.
Right, Jim, sorry.
Yeah, Robert, thank you very much. Thank you very much. Louise, you know, I've asked a question quite a few times about our staff and how they're managing with anxiety and how they're coping. And I just wondered today if you're able to tell us. You'd explained before that there are, and it's also in the appendix as well, about services that if staff are concerned or are anxious, there's an online service that they can contact, and also there's it can speak to people as well. I just wondered to date how much that service has been used, and do you find that anxiety levels have been less in lockdown 2 than they were in lockdown 1? Thank you.
Right, Jim. Louise?
Through yourself, convener, I think it would be fair to say in the unknown, and when the pandemic first hit, there was a high level of anxiety, but that tended to be around PPE. And I don't think unsurprisingly, the health and social care staff really rose to the challenge and have throughout COVID, and have been absolutely dedicated to making sure that people got their services. I think it would be fair to say by the time we've got to the second wave that staff are tired. A lot of staff have been working non-stop. We've had to actively encourage our staff to take annual leave. And the Promise website, we know that we did a lot of promotion in relation to that, and that we had a higher uptake in January, December and January time than we'd previously had at any other time. We have had individual focus groups with staff, and we've been promoting, we've got Mark Watson working with us, and we've been promoting a whole range of things in order to promote well-being in relation to mental health.
Jim?
Thank you. It's good. It's good to hear that. Thank you.
Convener, can I go back?
Yes, Charlie.
Just at G and 3.1, and it's the introduction of a new drug and alcohol in a system called DAISY. What's the difference in what they use now in DAISY for people that's got alcohol and drug problems? Is it more information, or is what happens?
Councillor, I hate to say it, but we're actually going to be talking about that in
Well,
4.7.
sorry, it's on 3 point.
There's
It's on
an update
3.1.
on Daisy. So if
Sorry.
you
It's on
hold
3.1.
back.
Fine, I'll put it back. Put it back. It's all right.
Through yourself, convener, but it's good again, Councillor Rebecca, that you're giving Anne fair warning of what you were going to ask in relation to the alcohol drug up.
It should have been 3.1 then.
You know. So is there any other questions on recovery? Is that Chris McLeary, 4.2, Chris?
No, that's 4.2 is the next. That's response.
Oh, sorry, Chris, sorry. Aye. Oh, wait. You're jumping ahead of the game up. Anyway, 4.2, 4.3, 4.4, and 4.5 will be delivered with Alan. Alan, on you go.
Thanks, convener. Just for the benefit of the members that weren't obviously at the previous all-member briefing, I'll just go through very quickly. The vaccination programme's been a really significant piece of work for the HSCP. My colleague Martin at the council's looked after the mass vaccination sites. I'll probably just, my comments are around the work that the HSCP have had to directly coordinate, from the work with the GPs in relation to housebound patients and the over 80s. Just an indication, at the 23rd of February, we'd achieved 95.5% for the first dose. For the 75 to 79-year-olds, we achieved 95%. And for the clinically extremely vulnerable so far, with 90.9%. So the GPs have been very active in making sure they've got out and vaccinated that cohort of people. In relation to my other groups of staff, the care homes have been a significant and priority one for us, as laid out by the Scottish Government guidance. In terms of the first doses for residents, we achieved 95%. We have also now completed our second round of doses for the care home residents, and that's just about hitting 90% at the moment. The reason it's not at 100% is some patients will be in hospital, obviously, some folk recovering from COVID not able to get the jab, but we'll have a series of mop-up events to make sure that the residents who are indicating a willingness to accept the vaccination will receive that. In terms of the care home staff themselves, and for the first round dose, we achieved 79%, and we're in the process of completing round 2 as well for staff, and we've put on a public health event on Monday for the staff who are nervous about accepting the jab, and there are a small group of staff who, for various reasons, including issues and worries about having children at some point in the future, for example, or issues to do with breastfeeding. There's a whole range of issues why people have come forward. The staff group said they wouldn't take the vaccine, and public health put on a session on Monday. We had 34 staff turned up to that session to listen to one of the public health consultants give some background in relation to the COVID vaccination and implications of that, and that's been well received. So it's work in progress. It's a significant piece of work for us, and we are working through. And just to confirm, we have been out now and completed the second round doses for the residents in the care homes. I mentioned earlier that's gave everybody a huge lift. The staff who have been vaccinating, it's really made people full of hope. The fact that they're seeing the residents taking the JAG, and obviously less people being admitted to hospital now already, which was part of the national feedback that we've had so far. But locally, our vaccinators, it's really made a difference in morale to see the older people in the care homes being vaccinated. We've got a small piece of work to do, starting on the 1st of March with the adult care homes, and that will be done over a couple of days because we have a much smaller amount of adult care homes, so that work will be concluded next week as well. So I don't know whether, also I've just mentioned there about the PPE Hub. Undoubtedly one of the success stories we feel has been around how we've managed the PPE Hub at the Fitzgerald Centre, and we have distributed over 2 million items of PPE. One set of gloves represents one item. So there's been a significant amount of PPE shared across, and the lateral flow testing is now up and running, and this week the testing for care at home staff has also kicked off. So I'll maybe pause, and that covers 4.2.
Hold on, I think there's an answer. Aye. Councillor Chris McLean, the question of 4.2. Is that right, Chris? Chris McAleary. I think we've lost him at the moment. Oh, you want to just carry on to 4.3?
Thanks, convener. I think
Sorry,
Robert,
Robert. Can
Sorry,
I ask
Jim.
a question?
Sorry, Jim. I'm just
Can I
trying to
ask a
hold the
question?
Chris.
Could I ask a question of 4.2?
Yes, on you go. On you go.
Right, thanks, Alan. Alan, can I say, I think it's very encouraging. I was at a presentation earlier too, and it's very encouraging to hear the figures that we've heard, certainly across most of the groupings. And can I say thanks to everybody involved in the process for the vaccinations. And if you could extend those thanks, I think not just my behalf, but everybody's behalf. The question I've got is that I think you said there that 79% of staff so far have been. 79% of staff have been vaccinated, and that there was a number of people, a small number of people who had a question and answer session, and that some of those people are also now taking up the vaccination offer as well, which is good news. Can I ask a service? Are you content with that 79% figure, or is that a comfortable figure for us to continue with? I mean, is the service basically happy with that?
Convener, through yourself, thank you. What we have agreed to do is we have a mop-up session on a Sunday once a month at Louisa Jordan, so we're not content with that figure, and that's why we asked Public Health to come in and do a piece of work, because we recognise there is a small but significant group of people who work in the care homes who have maybe read their own information on social media or other sites. So what we wanted to do was give the staff feedback from a consultant in public health. That happened on Monday. That has been recorded, that session, and that session has been sent to each of the care homes in Inverclyde, and actually it's best practice across Greater Glasgow now, because the consultant took the time to work through each of these issues that the people raised. So the answer is no, we're not content with that. Just to remember, it is a voluntary agreement, it's a medical intervention, but we want to get that figure up as high as possible, and we will continue to give access to the mop-up sessions at the Louisa Jordan once every month for staff who do come forward and decide they want to take up the offer of the vaccine.
Thank you for that, Alan. Alan, can I just ask? Sorry, just one supplementary, if I can, to that, please, Robert. The supplementary is that whilst I see it's a voluntary thing at the moment, do you envisage going forward in the future that care homes, when advertising jobs, might have that as an essential requirement for vaccination to have taken place before a job will be offered?
Convener, through yourself, it's a legal issue, and it's also one that I wouldn't be qualified to comment on. I think ideally we would like 100% uptake, but we have to work within the legal framework. So I don't actually know how that will develop. But my understanding is at the moment there are no plans to legislate in relation to this matter. That's my understanding currently.
Chris McAleary.
Thanks, Robert, through you. It comes under the broad topic of pandemic response, and I was just looking at the NRS numbers yesterday, and maybe if Alan wants to follow up, it'd be email. But I was just thought it was quite curious that the national average in 2021 for deaths per 100,000 looks about 49, and in Inverclyde we're sitting up at 76. But other neighbouring authorities, North Ayrshire 87, Renfrewshire 80, Glasgow's up at 102, and maybe as you would expect, significantly lower, Eastern Bartonshire 54, East Renfrewshire 48, but Western Bartonshire at 47 kind of jumped out at me. But I was wondering that maybe speaks to what Mark McNabb was saying earlier on, that they've still got quite a high level of infection. So is that unfortunately something that high level of infection in the weeks to come would see that become similar to the authorities not counting Eastern Bartonshire and East Renfrewshire? Or is there a particular reason why Western Bartonshire's not particularly low, but certainly much lower than Inverclyde, Renfrewshire, other neighbouring authorities?
Convener, for yourself, I'd be happy to go back and take some advice on that and come back to Councillor McElhaney in relation to that. I'm not familiar with the Western Barton figures, but I'd be happy to go away and have a look at it and come back and report back.
That'd be fine if you obviously you don't have the information at source. Are you all right with that, Chris?
Yeah, that'd be good to just maybe just circulate that to everyone, because I suppose it links into that. I think it was Councillor McCabe had raised earlier on in the pandemic when the health board had kind of made the reference about it was just bad luck how certain areas were impacted. But obviously the fact that I suppose authorities that you could say have got more in them still appear to be double the national average. We're certainly double authorities, well not double, but significantly higher than authorities like Eastern Bartonshire, East Renfrewshire, etc. It kind of really just, I suppose, debunks that observation that it was bad luck, whereas obviously I think deprivation is a factor which I suppose should feed into the council's decision making going forward.
Thank you for that. Alan, you want to go into 4.3, the flu?
Robert, can I just quickly come in on the point that Chris was raising?
Forest, you're not a secret. Aye, on you go.
Yeah, Alan Puckton produces figures that looks at the rates of death per 100,000, so they can absolutely be shared with members. The interesting thing in terms of our position is that in the first wave of the pandemic, we were the highest rate per 100,000 in the country. Now, in terms overall, we have slipped down. I think we're maybe about 4th or 5th now overall. But in the second wave, we are significantly, in terms of rates per 100,000, significantly lower than the top affected council areas. So there is something different in Inverclyde in terms of the second wave from the first wave. But I think it would be helpful if those figures were circulated to members, and certainly Alan has done that analysis.
Thanks, Stephen. That's very helpful. Alan, 4.3 flu.
Thanks, Convener, through yourself. Just an update on the flu. From my perspective, I think the flu campaign went reasonably well this year. If you look halfway down the paragraph, we've an uptake of 82% against a historic update of 73%. So there's definitely been this year, people have decided to take up the flu, and very interestingly, flu is almost non-existent in our hospitals and across our community this year. That's a very interesting fact, that we have had a good response from the public in relation to the uptake. So that's encouraging. But I say that activity has stopped now in relation to the flu, and it will certainly, having delivered that campaign this year, there are some things to take forward in relation to how we make sure we get as a good an uptake this year again. And the staff feedback has been about getting that message out early to people, starting earlier than we normally do this year for flu, and start a kind of social media campaign around that to make sure the people in the community and their own staff take up the offer this year of flu. It's been very interesting that the flu this year, because of the behaviours that we've had to, in terms of being isolated and washing our hands and keeping our distance, have all had an impact, and really not making flu a big issue in all the parts of the service that I'm responsible for, usually in delayed discharge. There are significant factors with flu, and that just hasn't happened this year. So I think we've had a reasonably good flu campaign, and we'll use that learning for making sure we start a wee bit earlier this year for this winter coming.
I've got two questions from the first one from Stephen McCabe and then Natasha. Stephen.
Yeah, I mean, just in flu, and officers know I've this issue with them, that the government did raise the expectation that those in the category 55 to 59 would for the first time be offered universally the flu jab this year. It never happened, and nobody ever, in a sense, publicly made a statement as to why that didn't happen. So I would hope that in terms of looking at next winter, that potentially that communication is better, and we actually can deliver on that expectation that was given to that age group. And I know there's probably a few on this meeting that fall into that category.
Right. Natasha.
Yeah, thank you. Thanks, Chair. I just had a question around. There was issues with supplies of flu vaccinations at certain GP surgeries. Has that meant that there's been certain surgeries or certain health centres where people have maybe had a lower uptake purely because of resourcing? Because I know that, I think it was Cochrane Medical Practice, they had stopped sending invites out to people. That's just an example. I've been told that other places have had a similar issue. So how many surgeries were affected by this, and has that led to maybe some people missing out this year when previous years they would have had it?
Convener, through yourself, I'm not aware that it's been a significant issue in relation to that, certainly not directly reported back to myself, but the uptake has been very good this year, as I said, in relation to the performance we have achieved. So I can certainly go back, and you've mentioned one of the practices. I can go back and just get some further information on that, but the intelligence is that we have people have came forward and they have managed to get that. I've also not had any level of complaint at all about the flu uptake or access or denied to flu. So, but I can certainly go back and find out specifically in relation to the practice that's been mentioned.
Thank you, Alan. I'll send you an email on it.
Thank you.
Thanks, Chair.
Lynn, do you want to have a question? Lynn Quinn.
No, just to speed it up, I was just trying to just put a question in the chat. So it's just really for Alan's reference to say we'll establish that whether the reduction in flu infection is due to increased vaccination or just due to less social interactions, because I think it would be useful to try and understand that. I mean, obviously, as a parent of 3 children, I've seen lots of infections have been reduced because they've not been at school and spread. Normally, the flu have been the healthiest winter we've ever had. So I think it would probably be quite good to see, I don't know who would provide that, but it'd be good to see whether it was the reduced social interaction versus vaccinations.
Convener, through yourself, I can certainly go back and get the experts to give us a view, but what I could say, my observation and medical colleagues have shared with us, that we always look to Australia and New Zealand to see what's happened to them, and it's the exact same pattern in Australia. They didn't have a winter of flu this year. So that would suggest that it's about human behaviour. It's about how we are behaving. That less social contact interaction has definitely had an impact on flu because it hasn't appeared significantly. And that was the same on the other side of the world, which we always look to see how that flu campaign goes, because they're ahead of us and we have mirrored that campaign with it almost non-existent in our community this year. I can certainly go back and get some clinical answers in relation to that, Councillor Quinn, but that's the general feeling and that's the discussion that's been taking place up to now.
Yeah, I think it's quite important to learn that lesson, because I think what we've learned now here is about self-isolation. You know, so really we should self-isolate when we've got the flu, but I think our culture's always been, you know, man up and get your work, you know, but really actually if you're thinking about your community, really you shouldn't be going to work. And obviously as council employees, we shouldn't be encouraging people to go to work if they've got any symptoms, even if it's the common cold or the flu. So I think there is lessons to be learned there.
Jim McLeod.
Yeah, thanks, Robert. My question was, well, my comment and stroke question was going to be similar to Lynn's. I mean, I've long thought for many a year, I've said that, you know, if people have got a cold or flu, rather than bringing it in, and particularly in an office environment, and sneezing and blowing noses and whatever, it'd be better if people took a couple of days off work. and it'd be a less transmission of these viruses. And I think this winter's actually proven that. I think, yes, the flu vaccinations have certainly helped, but I think certainly people being isolated from others shows quite easily that, you know, this is a way of eradicating these things. Can I ask Alan as well, is there maybe other things as well as flu that we could be looking at in the future to try and stop transmissions as well?
Convener, through yourself, I'll definitely go back to public health on that one. And it's not my area of expertise. I'm a social worker, but it's interesting that it really has been non-existent. So maybe a combination of factors are at play, but there's no doubt our behaviours have changed and people are washing their hands. And any clinician will tell you that if you keep your hands clean, you're off to a good start in terms of any of these issues. So, but I can certainly go back, Convener, and ask public health for some comments on that particular issue.
Councillor Doreen. Jerry.
It's just a comment. I'm a member of the Cochrane medical practice, and I actually get called to the town hall for my flu vaccination, and it just went seamlessly. I think possibly it's the practice may have been dealing with vulnerable people.
Thank you for that. It's always good to hear the other side of the story. Sharon McAleese, you want to say something?
Convener, I was just putting that comment in relation to the general conversation about the view of the clinical director.
Right, thank you, Sharon. Is there any other questions on the flu for Alan? Thank you. Alan, learning disability.
Thanks, Convener. Yeah, the work around the Learning Disability Hub continues. We're working closely with our colleagues in legal services to make sure get the appropriate permissions. We're working, Alan McClintock's on the meeting today. Alan and the team are working with my team in the service. We've got a key milestone around the end of March for the design phase. Clearly, COVID has had an impact in all parts of the kind of processes, but at this point, we are working to around the end of March having design phase. You'll know that TAG, the voluntary organisation, are working with us with an expert group, and we're keeping the carers reps and the service users involved in this as we move forward tentatively. There's obviously a lot of work still to do in relation to the hub, but we are continuing to make progress, and the key milestone is round about the end of March time. We're hoping to complete the design phase, but the very detailed planning going on at the moment, and obviously working with Alan McClintock and his team as well to move the project forward.
Thank you. Is anybody any questions on the learning disability? Jim?
No, I'm fine, thanks, Robert.
Okay, thanks for that, Alan. And 4.5, Riverclyde Homes model. Alan, it's a new model.
Convener, thanks to yourself. Riverclyde Homes are working on the model around support at the two places mentioned. Just in terms of an update, my team have went back to Riverclyde Homes to make sure that they are clear. It would be best practice. We consider that they should be making sure there are regular updates in relation to this, but also to include the ward members specifically in relation to these updates, so that we keep everyone up to date in relation to what's happening around the proposed model. As I said, due to COVID, it has been a bit slower. Joyce Allen, my service manager, is working closely with Riverclyde Homes around this, and we will make sure when the progress is getting made and we're getting feedback on the consultation that they're undertaking, that we'll come back and give a regular update in relation to that, and to make sure the ward members are kept up to date with any significant issues.
Is anyone got any questions? Jim?
Yes, Robert.
On you go.
Yeah, thanks, Robert. Riverclyde Homes, I'm sure they contacted the other ward councillors. They contacted me and I had a meeting with, I can't remember the RCH officer now, his name, but I had a meeting with him. No, I mean, for us, we're around some years back when the changes, you remember, from sheltered housing complexes, they used to have warden service 24/7, and then that was changed from Monday to Friday from 9 till 5. And away early on, there was a lot of concerns by residents at that time. Anyhow, over time, I think people just adapted to the change as it was, recognising there are other services going to sheltered housing. I'm just wondering, I know I don't know if the consultation's finished here yet regarding this move, but I just wondered if you were aware of any concerns from any residents. I mean, I did raise the matter with the official from River Clyde Homes that if there was any concerns from people, and also could this be seen as just a cost-saving venture, and could we see this? I know it talks about Moncton Place and Glebe Court, but could we see this happening with other sheltered housing complexes through Inverclyde if this works?
Convener, through yourself, thank you for that question. Our staff are working really closely with River Clyde Homes, so my understanding is the consultation is not concluded yet. Joyce Allen, my service manager, very much is involved in the process, and we would always step in and offer assistance if required. If there was any specific concerns that a family had, River Clyde Homes would speak to us and we would organise to speak to that family, Councillor MacLeod. So we certainly will be, we're very closely involved in the piece of work, and we will continue to offer that support if it's required. It is River Clyde Homes' piece of work, but the HSCP do have a good relationship with River Clyde Homes. We'll work alongside them, and Joyce Allen will respond to any of the complaints. And if that means we have to deploy some staff to have some joint discussions with families, then we'll be happy to do that. And I guess if it is successful, and we believe it will be successful, there'll be no reason to not think that they might look to use this again. So I think if it works well, then it would be a good model they can build on. But just to give you assurance that we will work alongside River Clyde Homes and we will offer support to any of the families if they do come forward. I've not had any complaints or contact from families up until now, and I've not had any members contact in relation to this issue specifically, but I did ask them to make sure the ward councillors are kept up to date, so I'll be watching, keeping a close eye on that as well.
Thank you.
Chris McElhaney, do you have a question? Chris? Right, obviously, we've lost Chris at the moment, but he'll probably come back in. Hey, thanks for Alan. Moving on now to items 4.6, mental health update. Anne.
Hi. You'll know there have been many changes with mental health services over the past few years with significant investment, and there is an ongoing programme of work which we have a programme board to oversee to continue that development and improvement. Just to address Councillor Rebecca's point, the mental health assessment units are units that have been introduced in response to the pandemic. And the reason behind them was to prevent people presenting for mental health assessments at emergency departments, and that was to reduce the transmission of infection. The Scottish Government then issued a directive that they should continue beyond and indefinitely. There are two units, one's at Leverndale and one's at Stob Hill. And while they exist, there is still the option for assessment to be done in Inverclyde. The mental health assessment unit primarily impacts in the out of hour period, and we see people being assessed locally during the hours that the community mental health teams are operating. But even though the mental health assessment units exist and are out with Inverclyde, the option still exists for staff to come down and assess with Inverclyde. And actually the mental health assessment gives those staff more flexibility, because previously those staff would have been managing a huge volume of calls, but the calls have been taken away from the mental health assessment units, and the staff there are freed up for just to do face-to-face assessments. So hopefully that covers Councillor Rebecca's point. And with regard to ongoing development, we have a development session planned for March with the IJB with a focus on mental health services. and the aim is to look at how we can continually improve the service and make Inverclyde a more attractive place for mental health staff to work. And we have highlighted that there are some issues with recruitment. And the likelihood of that development session is that there will be further significant investment to ensure that we make mental health services within Inverclyde a more attractive place to work. The only other thing I would maybe add at this stage is that you've no doubt heard about the COVID-19 outbreak within our mental health inpatient settings. I just want to give some reassurance that infection prevention and control are reviewing frequently and ensuring that all the appropriate measures are in place and infection control measures in place. Happy to take any questions.
Councillor Rebecca.
Thanks, convener. Thanks. My concern was, I read this and it tells me there's going to be a new assessment centre, and it says it's working the mental health services Monday to Friday, and then it's after that it's the other place, and it's out of hours and at weekends. Now that says to me that there's nobody working in the unit as it is right now at the weekend, and that starts to worry me, because we all know what happens with mental health at times. And funny enough, yesterday on television they were talking about two various people that had different illnesses through this, and they were various ages. Now, right now we're going through an awful time with that virus, but worse than that is mental health, and it's been there a long while, and I've said for years there's never been enough money pumped into it, and they were talking about it. And my concern is we had a big increase in homeless deaths. Was that through alcohol? Was it through drugs? Or was it through not knowing where to go or what was happening? And it's harder, and it's all right for us that can get from A to B, but if they've got to start moving out every weekend, and that's the busiest time, and they're talking later on that you're working with the police, well, I'm sorry to say, I don't know how the police are going to be working with you. And it's not, it's because some nights we're lucky we've got a police officer doing the street here, seriously. And now with the Scottish Police Force, they can be shifted out of here just like that, and they're going elsewhere, and they're working in Paisley, Glasgow, or anything else. Even if it started their shift here, they can suddenly be shifted. At one time, you at least had a steady shift pattern in this area. Now, to say you're going to work with somebody that you can't rely on through no fault of their own, and turn around and try to deal with people in mental health, and you see the state they're in. I have problems with someone I know that does stuff, self-harms, and at times it's awful, and it's a shame, and I don't know how more I can help to try and stop her doing things even at that time, and that's one of the things. But I know a lot of people, and when I watched the programme yesterday and the different ages, it really came back home to me, as I said. And I'm involved in alcohol, and I've worked on it, if you don't let me, and I know the effects of that, and I've got a lot of people that I know personally who are alcoholics. I do anything to help them, and that's what I was looking at, and that's why I asked about Daisy what HIT does. So if I can find out the whole setup, at least I know in my mind things I can do. But I think when you look at it, we were the worst for this vaccine, this virus. We're the worst now for the deaths of the homeless people, and what's causing it. And if we find that out, it might help, and it might stop other people going down that road. Okay, thanks, Anne.
And I think Councillor Becky just look for some reassurance that we don't work 9 to 5, and if there's a problem at the weekend, they will be seen to. That's just a reassurance that we need of you.
Yep. So the community mental health service, there is a service there till 8 o'clock at night and till and Saturdays and Sundays till 5 o'clock. They will offer a service to people who have acute crisis. That service would continue. It would be people who are presenting new to the service that would
and there seems to be another noise coming through when you're speaking. I'm sorry about that. So
right.
It's not your fault. It seems to be something happening coming through.
I might maybe I'll switch my camera off. I'll switch my camera off. That might improve the. But I'll keep speaking. So yeah, the mental health assessments the community mental health teams will still provide a service 7 days a week, and people who are known to the mental health service can access them. The mental health assessment units will be there for people who are not known, but as a result of that, the assessment can be filtered to the local team and be done locally. So there's a blended approach, and we're trying to be as flexible as possible to make sure that we're offering a service to the people locally. The issue about the homelessness, that's something that we only have those figures that were released, but that's something that we're undertaking, is to do a bit of analysis around those figures, to map them and to get more detail and to see what we can learn from those figures and what improvements we can make. So that's a piece of work that we will be taking forward. And with the police, the idea of the mental health assessment unit is that will free up the police's time, because they can take somebody to the mental health assessment rather than waiting 4 or 5 hours at an A&E department. So those would be the people that the police are already picking up because there's been a disturbance or because they're unwell or there's been a concern. So it would be people that the police are already involved in, and the idea would be that it would reduce the time that it takes. Sorry, I can keep hearing some feedback.
Thanks. That's, I know the police officer, if no option to do that, but when I read some of the stuff, it was like a nurse, mental health, and a police officer assisting her. I'm telling you how bad it is, and it's a shame. We don't have the police officers, and we certainly don't have them in this area. All I'm saying is what you should do is maybe check out and ask them for the last, and I don't mean during this, even last year before we went into this, how many police officers were on some nights, and I'll tell you honestly, you'll get a shock. I can assure you that, because I've been involved with it and found out, and it's a shame because the way this pattern works now, it wasn't a 2 to 10 and 10 to 6 and all these things. Now you're all different hours of starting, different hours of finishing, even at 3 in the morning and 4 in the morning. That's what police officers are doing now. And that never happened before, because they were on to 7 in the morning. So you're left picking the tab up. I just don't want to see a service coming in, depending on people, and it's not their fault, it's the way the systems work, that they can't assist us if we need them as well. I want assurances, that's what I'm talking about.
Maybe a question for the Police and Fire Scrutiny Board, Councillor Becky. Maybe get them to contact the police and ask them.
I think you're right as well, Convener, but I'm serious. When you're working with somebody, you've got to know you can rely on them. More so in places like that, and the person doesn't maybe realise what they're doing, and they need help, and the poor nurse or doctor gets abused by because of, okay?
I feel understand that. Jim McLeod.
Yes, thanks, Robert. And I know that this section is more looking at the strategy. I've got one question from the strategy, and just a general question, if I could be permitted. First of all, I just wonder, I mean, we keep on hearing the Scottish Parliament and in other parts of Scotland there's greater demand for, there's a rise in people with mental health issues. And I just wonder what the picture is, and up-to-date picture that is in Inverclyde. Are we seeing much greater demand for services and for help for people with mental health problems? And my question regarding to the strategy itself, it talks about consultant recruitment is difficult. Can I ask, is that consultant recruitment difficult just in Inverclyde, or is that a nationwide problem?
The consultant recruitment is an issue across all of Scotland. It's an issue everywhere. It's been particularly difficult in Inverclyde for a bit of time, but it's an issue across all the GGC and beyond. The impact of mental health, or the impact of COVID on mental health, the mental health teams are busy. The referrals haven't increased significantly at this stage, but we do expect that once people are feeling more able to get out and seeing GPs increase capacity, and to make sure that the mental health service as possible, and that was part of the strategy before COVID, but that will continue. We're using a range of measures to try and increase the capacity. So using the Near Me or Attend Anywhere given for digital consultations, that improves the capacity because it saves staff travelling time. There's lots of efficiencies that we can build capacity there. We're also developing across GG&C. There's a group programme that's going to be delivered remotely that people can, so that's a resource that we can use across GG&C so that we can get more people more effectively and efficiently through group programmes, and they can do that remotely. There's some work being done with CVS and the local organisations to improve the wellbeing of the general population. We also have a primary care mental health team who can do some short interventions, CBT type interventions, that people can refer directly to there. So there are a whole range of levels of service. Sorry, that's echoing again.
And you're breaking up again.
I've switched my video off. Is that better?
Yeah, it's better, right?
Yep. What does that say?
That's fine.
Okay, thanks.
Right,
Thank you.
thanks for that. Jim, you got another question?
No, I was fine. That was just the two questions. Thank you.
Right, thanks. And it's the alcohol and drugs update next, so you'd like to say something about that?
Okay, I'll just keep my video off because it just seems to make the quality better. So, as you know, there's been papers on the ADRS and the ADP papers presented regularly at the Health and Social Care Committee. The papers have covered waiting times, a service redesign, and we agreed to present on outcome measures. So that hopefully will answer Councillor Rebecca's question about.
And you're breaking up again. Can we maybe, I don't know, Al McDonald could, Louise, could you maybe help out here?
What I'll try and do is I'll try and present the paper, and then Anne can see if she can get in to answer any of the hard questions. How does that sound? Okay, Anne can walk around to Alan's room and then she can answer any of the hard questions. So, as Anne was saying, we made a commitment to the Health and Social Care Committee that we would bring regular reports in relation to the alcohol and drugs service, and in particular the social care element of that. We've presented a paper about the redesign of the service. We've also presented a paper about some of the performance previously and showed the improved waiting times. We've also presented a paper in relation to recovery. This paper, this section of the paper is about DAISY. So I made a commitment and a challenge to ourselves really that we would get 300 people off of who have been long term in our service, and we would get them into recovery. But in doing that, actually, we don't have any way to measure whether people have went into recovery. There's a number of people who have went through the service now, and the DAISY is an opportunity for an outcome kind of system which will measure outcomes for us to tell us whether we've got people going into recovery and then whether they've went to more positive destinations. It was due to be implemented and it was delayed for a whole range of reasons, not from Inverclyde's doing, but actually in relation to the government. And now we're at the stage that we want to implement it on the 1st of April 2021. And I am happy to take any questions in relation to that, and Anne can also assist if she's in Alan's office. I do good. Is that okay, Anne?
You back with us, Anne?
I'm back with us as Alan Stevenson.
Right. I have Chris McElhaney and then Stephen McCabe. Chris?
No, Robert, I never asked to come in unless I've accidentally hit a key, sorry.
Oh, right. Councillor McCabe.
Yeah, thanks, Robert. At the last meeting of the committee, we obviously discussed a report on drugs death and the significant increase in drugs death, both locally and nationally, which led to the resignation of the drugs minister and a new minister being appointed and the First Minister taking personal charge of the matter. And indeed, that subsequently led to an announcement of funding for drug services. I think £250 million spread over 5 years with an initial allocation of £50 million. So we're interested to know what Inverclyde's share of that £50 million is and what we intend to do with that share of the £50 million.
And did you hear that all right? I think you're on mute.
Doing well, aren't I? So we've had 81,000 of an award approximately so far, and some of that's about residential rehab. So we'll be processing that fund through the ADP, and any other awards that we'll take those through the ADP route and allocate them through that work plan.
Just to clarify, Robert, are we expecting more than 81,000 from that 50 million, or is 81,000 our total lot? Because that doesn't seem a lot of money, to be perfectly honest, for the council area in Scotland with, I think, the second or third highest rate of drug deaths. And doesn't sound to me as £81,000 will go very far in terms of addressing sort of the need for recovery services. And a big issue that was obviously highlighted in response to the report was the need for sort of in-house recovery services, needing for people to attend hostels, etc., to get supported. So I would be interested to know how far that £81,000 is likely to go, and is that our sum total from that £50 million?
Anne?
Happy to come in, but I think Louise is.
Louise, you like to come in here?
Just as the chair of the ADP, through yourself, convener, the 81,000, 50,000 of that will be spent on residential beds, and the other 30 odd thousand will go some way in relation to the naltrexone project. We've also got some monies in relation to naltrexone, which is a kind of pilot, and I think that's included in that money that was announced by the Minister. That's 152,000 over the next 12 months. I would say that we could spend that money 3 times over in trying to put a recovery community together, and we expect more money, but we don't know whether it will be ring fenced. So the 81,000 that came in, we were told that we had to give a certain percentage of that in relation to residential beds. We do have a alcohol and drug strategy, and in that strategy we say how we would spend any money as it comes in. Unfortunately, if the money is tightly ring-fenced, it means that we then have to go back to the drawing board, and we're not able to spend it on some of the things that we think would best impact on the alcohol and drugs, having done a lot of work to understand what we need to do in order to develop a recovery community.
Ian?
Yeah, I mean, I'm not an expert in this area, but I'm a bit disappointed by the scale of the resources that we're talking about. I would have expected a far greater sort of response in terms of resources to what people accept, and the First Minister accepts herself, is a crisis, an absolute crisis. So it's pretty disappointing, and I think it is important that the Alcohol and Drugs Partnership looks at how we can make the best use of the resources, and that also means speaking to the IJB and speaking to the council about potentially how further resources could be put into this area, because there's no doubt it's a major issue for the community.
Elizabeth Robertson.
Thanks, convener. It's just a comment on that. I agree. £81,000 is a block of money, but only a block of money and not the solution. I know that I've opened a line of dialogue and communication with Angela Constance in terms of this, and I'm assuming that's happened from other parties and other avenues as well, because I think as a starting point and a building block, it's certainly something that we can use. But the important thing is to build positive relationships with Angela as she develops into the role that she's got, to make sure that she completely understands the distinct situation that we have here in Inverclyde, and that resource is really only the start of much more to come, having built a really positive relationship with her and helping her know where we're at and what we need.
Right, okay, Elizabeth. John McLeod.
Yeah, I mean, I was just going to more or less say what was as you said there. I think it's a case of seeking clarification about what slice of the cake we get of that £50 million. But you know, Liz, as she just said there, is contacting the minister to try and get some clarification on that.
Yeah, hopefully there'll be more money on its way. But as I say, that's a good update. So thank you for that, Anne. Anybody, any more questions for Anne? No. Okay, move on to 4.8. The promise.
Thank you, convener.
On you go.
Thanks, convener. So if I deal with these in turn, so and I'll pause after each section. So in respect to the promise, members are aware of the scope of the promise, being the plan that has resulted from the review of looked after children provision and family support across Scotland, carried out by Fiona Duncan. The report that produced had 7 individual reports, but overall under a badge of Keep the Promise. Myself and the service managers and children's services in some other council areas have been working together since actually in advance of the publication of the report, being aware of the general direction of travel, and we had put together a fairly ambitious and quite a detailed plan of how we would respond to the findings of the promise. And helpfully it's called I Promise, which is Inverclyde Promises, which we think is really helpful and also really useful that we don't have to change the name of Inverclyde. So the I Promise will be the Inverclyde response to that, and we would like to get that, when time allows, a detailed report of that plan to members for scrutiny and for comment. But in the meantime, we have two opportunities with very short timescales. One is to submit an application for some funding from the funding stream that's associated with the promise, which will our share of which could be up to £50,000. And a second opportunity, which to be honest has really only emerged in the past couple of days, which could provide funding significantly in advance of that, which would allow us to really reach the heart of the ambition that we have for this work. But you'll be aware this is a 10-year work programme, and the promise is further broken down from that 10-year into a 3-year delivery plan with a 1-year progress report that we will provide. So the specific Inverclyde work will sit within that broader national work, and we're just very keen to progress this work and to realise the changes that we would like to. Members will know we're starting from a strong base in Inverclyde, but we still have much work to do to modernise and bring the service up to a really world-class service, and that is what our aim is to do. Happy to take any questions.
Councillor McCabe.
Yeah, thanks, Robert. I mean, and I welcome the update from Sharon, and I welcome the proposals in the report, and the fact that we're going to get a more detailed plan in due course. And as Sharon said, obviously the delivering the promise is a 10-year commitment. Year 1 has passed. Unfortunately, it's been one of the most traumatic years in most of our lives. So I think we're still early days in delivering the promise, but I think it is critically important that we mirror at a local level the accountability that there will be at a national level. There certainly will be an expectation of regular reports to Parliament. There will be regular reports to COSLA as well, and we've agreed at COSLA that we'll have an annual update in the promise, and we'll regularly have the chair of the promise along to the Children and Young People Board. But I think we need to have that sort of scrutiny and accountability at a local level. So I would be expecting that we would certainly be having an annual report on the promise in Inverclyde and how we're delivering and what contribution we're making to delivering on the national commitment that has been given. So I would hope that maybe today we could, when the annual the plan is presented, that we can agree that we will have that annual report on Inverclyde's contribution to delivering the promise, so that we can demonstrate to both our community in Inverclyde and to nationally that we are actually making our commitment and that we are fully committed to delivering this ambitious plan for our young people.
Thank you. Lynn Quinn.
Yeah, thanks, Robert. Yeah, just a question on the promise. I think just speaking personally as an elected member who's also a corporate parent, it's just from the promise that really it would be helpful for me as a corporate parent is to find out, well, within all the promise, what is the things that I can be responsible for, the things that we can take forward as a group of elected members. I know we've got a plan from a council officer's point of view, but I would really like to pull out as corporate parents, and we've got that wider responsibility to these young people, to have a kind of list of things that potentially we could do as elected members. You know, I know a lot of the stuff come out about the language we use maybe, or the sort of cultural stuff that I think that we then could take on potentially, and I'm sure my colleagues would agree that it would be worthwhile and see exactly how we can contribute towards it.
Sharon?
Very, very happy to do that, and in respect to both the comments from Councillor McCabe and Councillor Quinn, more than happy to do that. We are, the plan, when you see it, is a co-produced plan that will have children and parents who are driving the plan. And as much as we have a huge ambition, a lot of the detail needs to be populated by the children and the parents. And I would say that would be exactly the same for members. So we'd be really, really keen to hear from members what exactly you think are the things that need to be represented and what are the things that you can contribute to the plan. But if I just highlight that both the comments that we've had from yourself, Councillor Quinn, and from Councillor McCabe is exactly what I would be looking for to see in that plan. It's leadership. It's about driving this agenda. It's about accountability and about demonstrating that we are making a real difference, that this is not a plan on a shelf, that we're taking it and we're really making it matter in terms of the outputs and the things that we're going to change. And those are the kinds of things that I'd be delighted to have that dialogue. But I'd be even more delighted if that dialogue was with young people and with parents, and that's going to be an exciting new strand that we're going to be introducing, is for members and other leaders to be able to, you're very familiar with, with speaking with young people, but this will be an opportunity to see the other side of that and to speak with young people's parents as well.
Thank you. Jim McLeod.
Yeah, I think I'm very much along the lines of what Lynn's actually said. I think rather than just reading what we're seeing on paperwork here, is how we can be involved, how we can help to help drive things forward. I think that would be very good if we could find more how we can contribute towards that. I can't help but think though, we hear so much about how our young people are struggling and in so many different ways, but just how much harder it must be for any children who are in difficulty or are in care at this time.
Thank you, Jim. Did anyone else get a question for Sharon on the promise? No, okay. Sharon, 4.9, the winter grant.
Really pleased to be able to report on this item. It's not a usual occurrence that we would have a winter grant in year for children's services, and this has been in recognition of the additional challenges that we've faced over the year in terms of COVID. In the first period of lockdown, we had a really significant increase in the number of children who became accommodated in Inverclyde, alongside a really significant increase in the rate of children who were registered on the Child Protection Register. And that has resulted in a significant overspend in that area, and that will be reflected in Angela's input at a later date. So some of this money was specifically to support the increased activity in that area. The other area that has been a challenge has been in relation to the children's hearings. Children's hearings stepped back quite considerably during the first lockdown. We're only really beginning to remobilise when the second lockdown then took place. So there has been a considerable hiatus, and much of the activity of the children's hearing has been moved to an online platform, which is extremely challenging for families, for children, for staff and for panel members, given the nature of the issues at stake. So the additional money here was in relation to speeding the recovery around the children's hearing processes. We have not been able to do that, and the government recognise that that is not going to be possible in the current climate. However, we have been able to use that to retain the money allocated for that, and how we've used that is for additional staffing to provide additional levels of support for children. And one of the areas that came with the increase in the number of children accommodated was a really, really vast increase in the number of children who required to have supervised contact for their parents. And within the context of COVID, that was really challenging us very significantly. So we've been able to utilise that to make sure that we are doing as good a job as we can in facilitating contact between parents and children over this period. This will be an ongoing area of challenge. There will be a significant backlog. We'll need to continue to work through that. The most, I think, pleasing aspect of this money has been the amount of money that we have been allocated that we can use to disperse discretionarily to children and families who are experiencing extreme hardship. And what we're in the process of doing is identifying a number of families that we know who are experiencing challenges with really deep end neglect. And we are allocating a sum of money to those families that will effectively lift them out of a range of circumstances that really demonstrate the worst aspects of poverty. In most cases, what that will mean will be refurbishment of family homes to make them comfortable and to bring them up to a good living standard, and particularly given that children and families are confined to a family home extensively, will ease significantly the family pressures. That allows social workers a good level playing field to be able to address some of the additional factors that cause that neglect to become sustained. In addition to that, we've been able to provide some additional support to our foster carers and to our kinship carers, and that will bring some relief in terms of that they have at their disposal for continuing to look after some of our most vulnerable children in the community. And I'm happy to take any questions.
Thanks, Sharon. I don't see in the chat. Jim, do you have a question? Hold on, Elizabeth.
No, I don't have any questions. Thanks, Robert.
Thanks, convener, for bringing me in. Can I just belatedly put in a register of my interest as a foster carer, merely from the point of view of I'm happy to have sat through this entire paper, but when it comes to making the decision on the recommendations for the expenditure of the money, because money is potentially going to foster carers, then I don't think I should be making a decision on that particular recommendation.
Thank you, Elizabeth. Is anybody else not on that? Winter Grant? Right, thanks, Sharon.
So this is the final item for, in relation to children's services, Councillor Moran, and it relates to members will remember that just prior to the pandemic, we managed to get in the support for the counselling support for children that had come through one part of the grant stream, and that contract was awarded for Action for Children, and that was established and operational, which was great that we had that in place as the pandemic unfolded. This is additional streams of money, and we've taken a relatively innovative approach to this in Inverclyde. We've tried to mirror our work in relation to GIRFEC, and we're taking a whole systems approach so that we are extending the type of support across our community. The kinds of areas we've used for this additional work stream for is to supplement further the support for children with additional support needs. We've provided some source of funding against our out of hours provisions, so that for children where 9 to 5 is not when the need arises, so specifically targeting out of hours, so after school time and weekends. And we've developed, we're in the process of developing an electronic platform that will support the referral of children across systems, essentially aiming for one door, so that a child or a family needs or a referring agency can enter into a system of support for children once and be routed into the right kind of support. We will also be doing some work around research and participation to help us to deepen our offer for children where there are emotional health or wellbeing issues. These are all currently navigating the procurement arrangements at this point in time. The plan has gone back to Scottish Government. They've signed off the plan. They're content with that. They will release the money. It's a matter of us now making this operational, and it will significantly enhance the range of provision. It will frankly transform the provision that we have for children in relation to these areas in Inverclyde. And I'm happy to take any questions.
Steve McCabe.
Yeah, thanks, Rob. My question's around the CAM service, and I mean, I'm aware that there's still significant pressures on the CAM service in terms of caseloads, in terms of capacity, etc. And I very much welcome all the initiatives that are being developed around young people's mental health and well-being. But I suppose the question is, when can we expect some of the pressure to be taken off the CAM service, or the CAM service be in a better position to manage the need that there is for that type of acute support, rather than obviously the sort of lower level potential support that the community services would provide?
So just a straightforward question there, Councillor McCabe. At current time and for some time, Inverclyde has been reaching 100% of its referral to treatment target in CAMS. And the reason we've been able to do that is by levering in a really small amount of additional resource into the CAM service. And that's been at our our team lead leadership level, which has been really, really effective, and is a model that other areas in Greater Glasgow and Clyde are looking to replicate, because it really is that and that local drive. And I would have to say also about our own scrutiny of our CAM services that has resulted in that performance being at 100% referral to treatment target. That, as you've absolutely nailed there in your question, is only part of the picture, because referral to treatment only tells you one measure, and it tells you about how many children are receiving a service. Whether those are the right children or not is the next part of the equation. And what we would like to do is to make sure that we, over a period of time, take those children with lower level needs and see these children picked up with these services that we're currently developing. Action for Children. Some of the support here is going to Bernardo's. We're extending the Action for Children support, the out of hours support, but also enabling our universal services to be able to hold children's needs longer and more thoroughly at universal level. which in turn will mean that those children with higher level needs in the CAM service get a much more detailed, potentially longer, but maybe not, but a much more detailed and focused and intensive service. And it will take us some time to rebalance the system in this way. Again, this is a 5-year strategy. We're at the beginning stages of that. Again, we've lost a year in terms of the pandemic, but all of the indicators are that we're in a really good position to get the forward momentum with this and achieve exactly what you've described as would be our ideal scenario, Councillor McCabe.
Thanks for that answer, Sham.
Councillor Rebecca.
Oh, thanks, convener. Sham, what age is a young person in this category? That's the first sort of question I want just to ask. It says young person, but we seem to have different ages, what you call a young person. So what age does this cover?
This provision actually extends up to young people up to the age of 26.
That's champion for that, convener. Now, what I was thinking on is, what happens when a younger person is in a house and part of the problems at the house, how do we get around that? Have we got to then take them into care to try and help them, or what?
Our approach to issues of the nature I think you're talking about is and always has been to avoid where we can removing children from their family home. And it's maybe really important to stress that the promise has really reinforced the importance of that. And in fact, what the promise is saying is, even allowing for the steps and the lengths that we take to avoid removing children, we need to go further. And that's part of what the promise will be about, is about how we do that, how we build what the promise refers to as scaffolding, how we scaffold support around children at home in the community to avoid the necessity of moving them from the family home. There will always be circumstances where that is not avoidable. In fact, there will always be circumstances where that is the first action and it is the right action to take. But we want to drive the number of occasions where that happens to the absolute minimum.
Thanks for that. When you said the promise earlier on, I thought I was at a guides meeting, and that's what they do, is take a promise. And can I add a little bit, convener? Earlier on, Jim McLeod was talking, and I'm here to Touchwood. We're fortunate in this area of good care homes for children to get into, and thank heavens for that. And long may that continue, because again, I'll say we are a caring community in Inverclyde, but it's good when we're homes, you look at them and you see the kids in there and what they've done and what they achieve with help. Thank God we're here, and they take advantage of that, and that's the way it should be. Thanks.
Before we go on, I think Peter McDonald wants to make a contribution. Peter?
So thank you very much, convener. Just a quick point regarding Councillor Robertson's declaration of interest. So strictly speaking, she shouldn't be in the virtual room when that decision is reached. So if I can ask the committee to deal with the other recommendations separately from recommendation 3. If we deal with recommendation 3 as the last item, we can then exclude Councillor Robertson from the room at that point.
Yeah, we will do, Peter. Thank you for that advice.
Convener, can I come in? Did we not have this at one of their committees, and it says what you do now to save energy? See, we're all in my house, you just mute them. Peter, does that help? So that they're not taking part, the person. In other words, Elizabeth, she's muted off.
The colleagues to my right, who you can't see at the moment, will do some fancy footwork where they put her in a thing called the lobby. So she's still in the meeting, but she's not actually in the meeting, and then they can bring her back in again. Yeah, although if we deal with that as the...
We'll always take legal advice, Peter. Thank you.
It's never too soon to call your solicitor.
Again, for nothing. Right, we'll move on to the next item of the agenda, and it's 4.11, the health and social care revenue and capital budget. And Angela.
Thank you, convener. This is a summary version of the Northern Revenue Capital Monitoring Report that comes to committee, and it's reporting the position at the 31st of December 2020. You will have noticed, though, I've circulated an updated appendix since the report has been written, asking for the projected outturn to be increased from 190,000 to 690,000 overspend. This is due to us we undertook a review of the IJB LMP and also the older people's residential care beds since we actually wrote the report. And what was evident was that the care bed numbers that we anticipated to increase towards the end of the year is unlikely to happen. So under the guidance with the IJB LMP, right for us to actually transfer that whole underspend against the LMP costs. So the increase of the 500,000 is in relation to that. In relation to the rest of the overspend that's been reported, there has been minimum movement from that overspend since the last report at period 7. And the update that has been provided, you can see that there is, we have highlighted the main areas of the overspend, and main areas of the underspend as well are included in the update. There is also an update given for the capital, and you can see that the capital spend is reflecting slippage of 16% of this at this point against the core budget, the approved budget. And we have provided a brief update again against capital projects for the Cross Hills Children's Home and the New Learning Disability. And we've also given an update on the IJB reserves. And the reserves at this point are in line with the phased budget as we expected at the start of the year. So we're only 6.6% behind. The last thing I would like to, sorry?
Well, I've a wee bit of a problem. So someone's phone or something, you know, if you're not speaking, put yourself on mute and possibly, you know, put the video off because there seems to be some sort of feedback coming there. Right, Angela, sorry for that.
That's okay. Did you hear mostly everything up to the earmarked reserves? Will I continue from there?
I did, aye.
Thank you. So the final point to highlight is obviously with the change from the 190,000 projected overspend to 690,000 overspend, we would like to propose an amendment to the recommendation at 3.4 of the report, just asking for the committee to note the projected overspend of 690,000, which is a movement of 154,000 since period 7. And again, just to highlight, that is mainly due to the 500,000 increase from the resident movement to the underspend to the LMP. I'm happy to take any questions.
Thank you, Angela. Does anyone got a question for Angela on the report?
Yeah, Robert, can I just ask, I mean, I know this is finance driven, this question, but it's just that I don't know how else I can squeeze it in, but we're talking about a projected underspend with respite services across older people's services of £159,000. I just wonder if it'd be appropriate here or maybe offline or whatever, just to find out, you know, if, and I can understand there are, you know, the difficulties with COVID just now, but, you know, if there are any respite services going on, and if so, you know, if we could maybe find out, you know, what is on offer at the moment. Thanks.
Hey, thanks, Jim. We could do that. Sure, we could. Right. If that's all for Angela, we'll move on to 4.12, independent view of adult social care. Louise. I lost Louise.
No, I'm definitely still here, convener. The independent review of adult social care, Derek Feely undertook a report at the request of the Cabinet Secretary. The report came out in the beginning of February. It's been debated in Parliament. It was over 100 pages long, 53 recommendations. There is the section 412 gives the kind of themes. It's broken down. It's about human rights, unpaid carers, developing a new national care service, commissioning, finance and quality. The key elements of the report are it's a significant investment in adult social care. There's a structural change in relation to where social care should sit, recommended, and no doubt we will need to do a members briefing at some point, probably after May, with more details about what the consequences of the report are. should they be taken forward. There is still a question about what's going to happen in relation to elements of the report, and COSLA and Scottish Government are working together in relation to that. Happy to take any questions.
Thank you, Louise. Anybody, any questions on the report?
Robert, I don't think it's a question. I just think it's for myself, just a comment. I mean, I'm actually glad to see this is happening. I think it's long overdue. I understand there will be consequences, maybe not consequences. You know, there will be obviously implications from it. But at the heart of this is very fundamental. It's a question of human rights. I was very taken. I watched a couple of news items about it. I'm very taken that at the heart of all this, it involves service users. You know, and I think that's at the heart of it, that they are actually involved in setting the programme and setting the agenda going forward. Thanks.
Right, Elizabeth Robertson.
Convener, I'm okay. Actually, Louise answered my question at the very tail end of her own comments. Thanks.
Thank you, Louise. If there are no other questions on that, we'll move on to the governance of external commissions. And Leslie, you want to speak to this?
Excuse me, Convener, can we just confirm that this is a private item? There are no members of the public here just now, so we are just, if you could just make the appropriate resolution just for the purposes of the minute. Thanks.
We're now going into a private session.
Thank you.
The public, please leave. Right, Leslie. Thank you, Leslie. Right, we'll go back to 4.13, which is senior management with Louise.
Through yourself, Convener, and thank you very much. The senior Leslie, who's just spoke, the lovely Leslie, is moving to a promoted post at the Health Board, and she's going to be the Deputy Director there. And currently Leslie is undertaking, she's the Chief Finance Officer for the Integrated Joint Board, but she's also undertaking the Head of Strategy and Support role. The HSCP would like to formally merge these two roles together. As the Chief Finance Officer, Leslie worked part-time. Now we would like to make this a kind of head of planning, finance and resource, and they would also act as the Chief Finance Officer in the IJB. When the IJB was formed, unlike many other places, we didn't take the finance from social care into the IJB, and we would like to use this as an opportunity to take the finance staff, which currently sit under Angela and Alan Puckering, into the IJB, which is in line with the national guidance in relation to the integrated joint boards. There was a review by government called the MSG, which came out in 2019, and that said that all health and social care should sit with the IJB. We would, in order to make this work, we would like to create a social care, we would like to create a finance manager who would manage health and social care budgets. We would do this on a temporary basis. This is to allow us to get an evaluation, which we would bring back to officers. It's also to give some assurance to the Chief Exec and the Section 95 officer in the Council that it is going to work. And in order to also, there's other changes. We've got a management review in relation to the IJB, which is the Health and Social Care Partnership, which has been outstanding. We've got a special IJB on Tuesday in order to look at the posts, and we will bring a fuller report back to the Health and Social Care once we've went through all the processes. Happy to take any questions.
Is anybody any questions on the new management structure?
Councillor Milan, I wonder if I can also come in about 4.4 because we missed learning disability. So just because I was going to go at the end and just go through the recommendations, I wanted to just give an update in relation to learning, or get Alan to give an update in relation to learning.
Sure, yeah.
That's okay. Alan, do you want to give an update in relation to 4.4? It's okay, I can do that if it's helpful. So 4.4 is just an update in relation to the Learning Disability Hub. Obviously has a programme board which meets on a regular... What's that?
Alan did cover that.
Oh, did it?
Yeah, sorry, Louise, I was just going to come in there. You confused me, but I covered
that. Mark Coffey's been done as well, so that's cool.
You covered the 20% open the Learning Disability Centre. Apologies, Alan, and members. Clearly, I'm not taking heed.
It's okay. That's all right. You know, Could just the opportunity to thank Leslie for all the great work she's done over the years, and we certainly will miss you.
Thank you very much, convener. I'm just going to quietly blush in the corner.
You want to clap? I'm quite happy. Right, thank you, Leslie.
Here, here.
All the best in your new job.
What would you plan to do with the extra money, Leslie? You know how you control money. Is empty in the house getting in and out of it?
My husband's got a list a mile long of what he's spending it on, so it's all gone.
No, he's got a list, and there's no chance of getting it fulfilled, is he?
Don't forget Inverclyde, because I know you would think, oh, she's got to work with a high heating, but remember us as well down here. So best of luck in your new job, and you've been a great servant, and best of luck. So that brings us to the end of the agenda. So we're going to the recommendations now. And the recommendation 3.1 is for noting. Item 2 is to ratify the HSP log, including reduction of some services to essential visits in response to demands of service capacity. So do we agree on that?
Agreed.
Number 2. Number 3 is the winter grant, which we're going to put back to the last item because we have to get somebody in the lobby for that one. So number 4 is for noting, which is a rejected outrun for social work. Number 5, again, is for noting the governance report from the period of 20th November to 2020 in January 21. Number 6, again, is for noting. And number 7 is to approve the temporary alteration of the Council Financial Reporting arrangements for the new post of Head of Finance, Planning and Resources. Would you agree on that?
Agreed.
Right, okay. So that means that could you ask Liv Robertson to leave the room to be discussed the item 3, which is the Children's Services Winter Grant.
Convener, I don't think councillor. I'd just say I don't think she needs to come back in if this is just the last item, but she is in the lobby now anyway, so we'll readmit her just to make sure at the end. Sorry, on you go. We thought she'd left, but she's in the lobby.
Right, number 3 is to approve the Children's Service Winter Grant Fund. Do we agree?
Agreed.
Agreed.
Okay, so you can bring her back in if you want to.
Councillor Robertson, I think you're now back in the meeting, but I think it's now just ended.
Thanks everybody for attendance today.
Thank you.
Thanks, bye.
Thank you.